successfully implement the National DPP Lifestyle Change Program, your organization needs the right staff and resources. As program coordinator, your responsibilities include overseeing daily operations, making sure the program meets the quality performance outcomes of the Diabetes Prevention Recognition Program, or DPRP, disseminating information and guidance across all networks, keeping your staff up to date on CDC communications, and performing other functions, such as publicity and marketing. You also have a key role in ensuring that your organization is fully ready to offer the program, including completing the Organizational Capacity Assessment and providing training for lifestyle coaches and other staff, such as the data preparer. Lifestyle coaches are on the front lines delivering your lifestyle change program. And while lifestyle coaches are sometimes health professionals, they do not have to be. Lay health workers, such as community health workers or promotoras and health educators, may also serve in this role. All lifestyle coaches must be trained to use a CDC-approved curriculum. But this is only the starting point. You will need to provide coaches with ongoing support and guidance, especially if they are new. This could include mentoring or offering additional skills-based training. Have regular discussions and performance reviews with your staff to evaluate how things are going and address any issues they might have.
The way that we evaluate our lifestyle coaches is we do have a master trainer that is available to act as a mentor, especially for our new lifestyle coaches. But also we evaluate their participant logs that they turn in every single week, just making sure that they're meeting the requirements in terms of capturing all of the data elements that are required, because that's such an important aspect of this program. And our master trainer does go out and does evaluation and make sure that we're covering the appropriate content of the DPP, and that they're using proper motivational interviewing techniques, and just really interacting with our participants as they should.
Lifestyle coaches also collect critical weight and physical activity data. If possible, you may want to add a specific data preparer to your staff to record and submit these data. In larger organizations, roles can be divided among different staff members, and in smaller organizations, a single person may handle every role. Always align your staffing with the goals and strategies of the Lifestyle Change Program and your organization's capabilities. For instance, you may need staff with specific expertise, such as speaking another language.
As part of the training for our lifestyle coaches, they're expected to meet people where they are and to just listen to the information that they're sharing in a non-judgmental way. We treat all of our members with dignity and respect. So unfortunately, we do not have a session that is all in Spanish. We just have not had that demand just yet, but we do have lifestyle coaches that are bilingual. And so if that need ever arises, if we ever get a critical mass of members who would prefer for the DPP to be provided in Spanish, we could.
CDC offers approved curricula in Spanish should your organization need it. As a program coordinator, you must have a complete understanding of the requirements for achieving and maintaining full CDC recognition described in the Diabetes Prevention Recognition Program's Standards and Operating Procedures, or DPRP standards.
It is important for the staff to understand what the DPRP standards are, because as they are out working in the field with participants, they're able to reinforce what those important standards are. And also they're able to let the members or the participants know why they are important.
Before you apply for CDC recognition, you should also encourage your staff to carefully read the DPRP standards and understand their roles and responsibilities. Using the resources on the CDC National DPP website will help with this, especially the technical assistance video on the Organizational Capacity Assessment, which will help you identify your organization's strengths and weaknesses and pinpoint any areas that need to be addressed before you start your program.
So the CDC Capacity tool helped us address key questions that the organization needs to answer to figure out whether or not this is something that we can do. So, do you have leadership support? So that was one of the first questions on the capacity assessment that let us know that's really important, because you have to have the support of your leadership for anything to be successful. Also, do you have the logistical capacity? Do you have the capacity to identify people who are at risk? We have Health Connect, which is our electronic medical record. And so that helps us really easily identify people who are at risk. So we knew very early on what our demand would be. We knew how many members we had who were at risk.
While the program coordinator has many roles to play, CDC is available to help you every step of the way as you deliver your lifestyle change program. Be sure you and your staff participate in all relevant CDC webinars, including the ones for new organizations and for data entry and submission. To learn more about organizational infrastructure and what else it takes to make your National DPP Lifestyle Change Program a success, watch the rest of the Program Coordinator series and visit CDC's National DPP website. If you have any questions, just send an email to dprask@cdc.gov. Before you make the commitment to offer the CDC National Diabetes Prevention Program's Lifestyle Change Program, view the Organizational Capacity Technical Assistance video and complete the Organizational Capacity Assessment on the National DPP website. This will help you decide whether your organization has the necessary staff, support, and resources to begin offering the program. Make sure all aspects of the program, such as scheduling classes and collecting and submitting data, adhere to the Diabetes Prevention Recognition Program's Standards and Operating Procedures, or DPRP standards. Review and discuss the standards with your staff, answer any questions they may have, and confirm their commitment to the program.
It's very important for all staff to understand the DPRP standards so that when they are facilitating classes for the participants, they understand what are the key components of the class, so they can reinforce to the participants the importance of attending class, and also they're able to let the members or the participants know why they are important. They need to make sure that we check off all of the appropriate boxes in terms of recording participant weight, and also recording the minutes of exercise or activity each week, which are very important for us to capture.
Once your organization has everything in place and you've been granted CDC recognition, you can begin offering classes. Keep in mind that your organization's effective date, the first day of the month following your approval, is used to determine the due dates for your required data submissions. As program coordinator, you're responsible for working with your staff to develop a master schedule of all the classes, including dates, times, and locations. Be sure you have a plan for delivering regular and makeup sessions. There are many tools that can help with this. Miriam explains what her program uses.
So another aspect that we use, or another tool that we use, is Outlook Groups, which is a web-based app that all of our DPP lifestyle coaches are connected via that, so they're able to communicate with each other on their smartphones. So we're able to use that not only to address logistical issues, but also to share pertinent information about the diabetes prevention program.
Of course, before you can have classes, you need to recruit eligible participants. Eligibility criteria are included in the DPRP standards. Participating in a community-sponsored screening event or speaking at a health fair is a great way to recruit. Another useful method is to hold an introductory class before the first session, referred to as Session 0, to explain the program and screen participants for eligibility. You can learn more about these sessions in the Program Coordinator video, Recruitment and Retention. Lifestyle coaches lead the sessions. You should provide them with ongoing support and training on topics such as motivational interviewing. This is a participant-centered approach to behavior change, which helps encourage participants to reach their individual goals.
Additional training, it's really important for us to provide additional training and education opportunities for our lifestyle coaches. One thing that we do is we bring our lifestyle coaches back to our regional office twice a year. And we just do a lot of role playing. We do updates in terms of just the day-to-day operations of the DPP. But it's an opportunity to create camaraderie among the group. It's an opportunity for them to learn about best practices from each other.
You need to help lifestyle coaches set up their classes, but this is only the first step. You should also schedule post-data reviews with your lifestyle coaches to evaluate the required weight and physical activity data they collect from participants. This will help both you and your lifestyle coaches to work together to identify areas that need improvement.
We work with the lifestyle coaches to track the progress of the participants by, again, ensuring that those participant logs are filled out thoroughly and completely every single week. Because it is a lot of data to manage, we want to make sure that there is diligence to collecting that information on a regular basis.
Program coordinators also serve a key role in working with lifestyle coaches on attendance requirements. The DPRP standards require that at least 16 weekly sessions be offered during the first 6 months and at least 6 monthly sessions during the second 6 months. You should work together with your lifestyle coaches to find the best ways to encourage participants to remain in the lifestyle change program for the entire 12 months and to complete the required 22 sessions. If you are able to add more sessions, especially during the transition from weekly to monthly sessions in the second 6 months, participant attendance may increase. Additional sessions must use a module from a CDC-approved curriculum. Curriculum modules may be repeated for this purpose. Unexpected circumstances, such as bad weather, can get in the way of attendance. However, you can prepare for this. Have a plan for communicating scheduling updates. And remember, offering makeup sessions is very important when classes must be canceled. From having the right staff and resources to advanced planning for makeup classes, setting up your program is crucial to its success, and CDC is always available to help you do it. To learn more, watch the rest of the Program Coordinator series and visit CDC's National DPP website. If you have any questions, just send an email to dprask@cdc.gov. Participants are the main focus of the National Diabetes Prevention Program's Lifestyle Change Program. As a program coordinator, recruiting and retaining participants are two of your most important roles. There are many ways you can recruit participants, such as collaborating and building partnerships with physician practices, pharmacies, and other healthcare groups.
So physician buy-in, having the physicians go out and speak to other physicians about the DPP and about the importance of it and about the different resources that are available has been really, really important for getting our physicians to feel confident in referring their patients to the DPP.
You can also work with employers and insurers and encourage them to include the Lifestyle Change Program as a covered benefit. In addition, you should include other local community partners as part of your referral network, such as senior centers, faith-based organizations, and other social service agencies. Peer recruiting and word of mouth, along with targeted efforts such as recruiting at testing and screening events for type 2 diabetes, can be highly effective.
I mean, we do such targeted outreach. I think our numbers show that, we have over 80% of our participants have an A1C, have a lab-confirmed blood test. I think that targeted communication really plays a role in helping people who are motivated really respond to that call to action. So we have a lot of motivated people who decide to sign up and participate in the DPP, and I think that's a really key first step by making sure we reach those folks who really need the program, who are most appropriate for the program.
Lifestyle coaches who lead your program's classes are the ones who keep participants motivated and coming back. To do this, they need to be motivated by you, the program coordinator.
As program coordinator, I think my most important role is ensuring that the lifestyle coaches remain motivated and aware. You want to make sure that they don't lose their steam, because the DPP is a year-long commitment, and so they have to remain motivated and enthusiastic about the program, because in turn they help our members maintain that motivation to successfully complete the program.
Lifestyle coaches also need ongoing support and training to build their skills. Motivated and skilled lifestyle coaches can improve program attendance and help participants reach their goals. Find ways to help lifestyle coaches rally participants to work together as a team to meet program goals. Lifestyle coaches may find it challenging to keep participants engaged for the full 12 months. As program coordinator, you can help them find new ways to engage participants. Schedule activities outside of regular sessions, such as dance classes, grocery tours, or healthy cooking demonstrations.
It's my job or my responsibility to make sure that I'm accessible to hearing what the different challenges they may face as lifestyle coaches, and really work with them and communicate and create a sense of community amongst the lifestyle coaches, so that we can all work together to learn about best practices, figure out how we address challenges, and again, remain enthusiastic and motivated around this program.
Your role as a program coordinator is integral to the success of your staff, your participants, and your lifestyle change program. Recruiting participants and keeping them coming back takes work, but with enthusiasm, motivation, and help from CDC, you can do it. To learn more, visit CDC's National DPP website or refer back to any of the videos in the Program Coordinator series. If you have any questions, just send an email to dprpask@cdc.gov.